Hand hygiene, provide privacy. Hey, my name is Chris. I've taken care of you today. Can you please tell me your name and date of birth?
Hayden Sumner, 10/16/03.
See your wristband. Alright, well, I got orders from a doctor to perform a head to toe assessment on you. Is that okay with you? Alright, before we get started, are you on any medications and do you have any allergies?
No medication and no allergies.
Alright, well, that being said, we're going to move into the assessment. We'll start with the head. Inspecting that, looking at the hair. There's no lumps, mumps, anything like that. Can you tuck your hair behind your ear? Ears are symmetrical. They're the right height on the head. The nose is centered, symmetrical. The mouth, can you open up for me? Is my pen light? Oral mucosa is good, it's moist, the gums are pink. Dentition's good. Can you swallow? Alright, no problem swallowing. Talking, the trachea is midline. Have you had any changes in your eyesight? What about your hearing?
No.
Inspect your nose too. Nails are good in both. Any trouble, or no trouble swallowing, but any trouble with taste? Nothing's changed in that. Alright, can you stand up for me? And face away. I'm gonna whisper a word into your ear, or behind, excuse me,
Okay.
and tell me what the word is.
Blue.
Alright, step over here.
Tree.
Alright, hearing is good. You can have a seat. Do you know where you are?
The hospital.
Alright, do you know what month of the year it is?
It's September.
That's
September
fine.
2023.
Alright, and who's the President of the United States?
Joe Biden.
That's correct. That being said, we're going to move into the respiratory part of the assessment. That's fine with you. And every time you feel the stethoscope touch you, take a deep breath. And this would normally be skin to diaphragm contact, but for the video purpose, some type of close. Alright, can you, your right hand grab your left shoulder? Take a deep breath. Same with the other. Alright, can you lean up for me? I'm going to check the back now. Right here. Alright. No adventitious breath sounds, there's no crackles, wheezes, anything like that. Everything sounds as it should. Have you had any shortness of breath or coughing? So you hadn't coughed anything up? Alright. Well, this right here is an incentive spirometer, and what it does is it helps you clear your lungs of anything and helps prevent against pneumonia. What you do is take it, most people try to blow into it, take a deep breath and suck, and see how high you can get it up on the gauge. And you want to do this 10 times every hour that you're awake. Like I said, it cleans your lungs, keeps them clean, and helps prevent against pneumonia. Another method for that is turn, cough, and deep breathe, and that does the same thing, is help clean out your lungs. So, like I said, 10 times every hour you're awake. Now the cardiovascular, listen to your heart sounds. Is that fine with you? Have you had any chest pain? None? we're going to start with, can you turn it a little bit? We're going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. And the mitral is the left second intercostal space, mid-clavicular. And that's the order you check them in. And use a diaphragm with a stethoscope for that. Alright, S1 and S2 are present. There's none at S3 or S4, so no murmurs, anything like that. So if you were to hear S3, use the bell with the stethoscope, not the diaphragm. But like I said, everything sounds good there. That being said, we're gonna check your capillary refill. Can you hand me your finger? Both hands. Alright, the capillary refill is less than 3 seconds. Now I'm going to check for edema. Working my way from the foot up the leg. You don't want to push anything back down into the extremity. Alright, now your arm. Same thing, pushing up the arm, not back down to the hand. There is no edema. I'm now going to assess for JVD, jugular vein distension. Can you lean back 45-degree angle and look to your right? Alright, I'll look the other way. There is no distension, so there is no right side of the heart failure. So nothing to worry about there. Pulses, I assessed her left radial, and it was 2+, normal, and regular. And you would also check the carotid, the axillary up under the arm, brachial, like I said, radial, femoral, popliteal on the back of the knee, dorsalis pedis on top of the foot, and posterior tibial on the back. And you want to assess all those bilaterally, except for the carotid. That can end very badly. Don't check the carotid bilaterally. With that being said, we're going to move into the musculoskeletal part of the assessment. And whenever I tell you to flex, I want you to flex your arm. When I tell you to extend it, I want you to straighten it out. Can you flex? Alright, extend. Alright, other arm. Flex. Extend. Alright. Now, flex. Alright, extend. Good. Flex. Alright, extend. Alright, everything's good there. Strength's good. I did feel resistance. Now we're going to move into the lower extremities. Can you scoot to the edge for me? Same thing. When I say flex, just bring your knee back to you, and when you extend, push it out. So, can you flex your knee? Flex. Alright. Extend. Good. Extend. Alright. Now, flex. Extend. Good. Now, extend, and flex. There we go. Muscle's good there too, and I did feel resistance. Can you stand up for me? And I want you to walk to the door and back. Alright, that's good. Gait is good, no stumbling, anything like that. Now can you do the toe to toe? I want you to, your heel to touch your toes and walk in a straight line. Heel to toe. That's fine. Balance is a little off, but. Alright, good. And last thing, I want you to put your feet together, your arms out, and close your eyes. Alright, balance is good. So you passed that part, you can have a seat for me again. Have you had any joint pain? None, knees, elbow, nothing? Alright, that sounds good too. If you don't mind, we'll have you lie down right here. I'm gonna listen to your abdomen and assess your abdomen. No distension, nothing's raised, everything looks as it should. We're gonna auscultate, we're gonna listen to your bowel sounds. Start with the right lower, then go up to the right upper, and then left upper, and then left lower. And listen to each of them for a full minute. Bowel sounds were normal active. Nothing was hyperactive, sounded as it should. And if you were to check for a bruit, you'd use the bell and check up here towards the top. Now gonna palpate. Do you have any pain in your abdomen? Nowhere? Alright, then again, start with the right lower. Checking for mass, anything like that. There were no masses, bumps, anything like that felt, so everything's good. I'm gonna assess the skin color. Hair distribution, not a whole lot of hair, but it looks as it should. Skin is appropriate for ethnicity. Like I said, there's no bumps, lumps, anything like that. Skin is intact, and so your ab looks good. Everything looks good right there. Can you tell me when your last bowel movement was?
2 days ago.
2 days ago. Is that normal for you? Is that what you normally do? Okay. Alright. Any pain with that? No? Alright, we can sit back up for me. And are you having any pain anywhere? No? Okay. Alright, well, everything went as it should. It all sounded good, looked good. Your skin was intact everywhere. So, if you have any questions for me? Alright, well, I'll be back in here shortly and we'll have your doctor come in and check you out too. Alright, no questions? Alright, thank you.